Nurses, our medical case management nurses, I talked about them earlier. One of my favorite programs at MESSA. My first job, like I said, was as a medical case management nurse. A program that's near and dear to my heart. We're gonna have them tell us a little more information, more than I can tell you, about medical case management.
Are we ready for us?
I'm ready for you. Let's
Okay.
go there.
Okay, so hi, my name is Karie Reed, and I am a nurse here at MESSA, and I have Melissa with me, and we're going to be talking about the medical case management program here at MESSA. So I think that I can go to the next slide, please. Do we see the slides? I don't see the slides.
Sharing now, one
Oh,
second.
perfect. Thanks. There we go. Okay, so we can move to slide 2. Perfect. Okay, so what is medical case management? Medical case management is a program that provides support, education, care coordination for MESA members and their covered dependents. So here at Medical Case Management, or we say MCM, we are really here for the members. Next slide, please. So medical case management. So with medical case management, we, the nurses here, support and we care for the members and their dependents. This can be a new diagnosis, serious, complex health conditions, chronic health conditions, undiagnosed conditions. It can be catastrophic injuries, multiple traumas. So we help the members in collaboration with external case managers to provide the best care for our members. Each member is assigned a nurse here at MESA along with an external case manager, so a nurse in the community as well. Next slide, please. So these are our beautiful nurses here at MESA. We all have a bachelor's of science in nursing, and we either are certified in case management or working towards that certification. We are here Monday through Friday, 8 to 5. There is always a nurse available. We are always a phone call away. So if you have any questions about medical case management, or if it would be something that would be beneficial to you or a family member, you just give us a call. Next slide. So our external case managers. So we are the nurses that run the care plan here at MESA, but we call them our boots on the ground. So our external case managers are our boots on the ground. They're going to meet the member either at their home or at their hospital. Wherever the member wants to meet our medical case manager, our external case manager, who is also a nurse, to help them enroll in the program. Our external case managers can help attend appointments. They communicate regularly with us and they collaborate with us and the member to facilitate the member's care plan based on what the member's needs are. Next slide, please. So these are our most common conditions that we do see. This isn't an all-inclusive list though. We would rather talk to the member and we don't just look at the diagnosis, we look at what the member's needs are. So just because it's not on this list doesn't mean that we wouldn't be able to help them in medical case management. So if there's ever, like I said, if there's ever a question, just give us a call. But these are the most kind of popular conditions that we see. So it's just the cancer, amputation, spinal cord injury, multiple trauma, that type of thing. Next slide, please. So medical case management, we're here to assist you. We can assist members with their mobility concerns, safety concerns, their social determinants of health, health literacy, caregiver resources. We create an individualized care plan with the member for the member's goals for their health care. We also can put them in contact with providers, durable medical equipment, therapies, treatments, and services. Next slide, please. We can also assist them with care coordination with multiple providers, and we help them transition between different levels of care. We are really good at identifying resources when financial constraints are there. We are very helpful in coming up with different ways to help them covered, non-covered items. We provide advocacy and support, and we give them education and help them understand their treatment options that their providers have given them. And now I'm going to pass it to my nurse, Melissa.
Hi, thanks, Karie. We can go to the next slide. I was going to start off talking with about a little bit about authorizations that medical case management can help with. We're able to consider things that are above the standard benefit. We do follow established guidelines and we have a process like to review everything. You can go back to the other one. A lot of the authorizations that MCM does handle are home modifications and vehicle modifications for our members who are not, or they're deemed permanently wheelchair bound. We also have a hospice custodial care fund, and that is above and beyond your regular hospice benefit. And what that provides is a set amount of money to provide for either room and board at a hospice facility or custodial care at home by a licensed professional, usually a certified nurse assistant. We also have private duty nursing authorized for our members with severe respiratory compromise. Usually they have a trach or a vent that they depend on for breathing. And then we have a Second MD program. We partner with a company called Second MD, and sometimes our members are having trouble getting a definitive diagnosis or have an issue with agreeing with the treatment plan or just wanting to see if there was a better treatment plan out there for them. Now, Second MD has doctors from all around the globe, and they get your medical information and go over that with you on a virtual appointment. So they meet you wherever you want to meet and can kind of give their expert opinion on either your care plan, diagnosis, or a treatment plan. And you can go to the next slide. So our goals of MCM, really, we want to be there for you in a time that can often be overwhelming. When you get sick, sometimes it's really difficult to kind of take in all of the information. It's hard to kind of understand everything that's happening. And sometimes you're just not that experienced with the medical care field, and we're there to help provide the advocacy, collaborate with the physicians, make sure everybody's talking with each other, and make sure that you feel confident in your treatment and your care plan. We want to make sure that you get back to your daily activities and as much as possible and be able to make informed treatment decisions. So we're going to help gather resources and really give you back that ability to feel like you can make it on your own. You can go ahead to the next slide. So frequent questions that we get a lot of times is my diagnosis appropriate for MCM? And what I would say to that is just give us a call. We can talk with you over the phone, and if your diagnosis isn't appropriate or doesn't really fit with MCM, then we could probably get you resources, or we can refer you on to behavioral health if that's a diagnosis. So medical case management takes care of medical diagnoses, and then Blue Cross Blue Shield Behavioral Health, we partner with them for behavioral diagnoses. We definitely, basically, I'm sorry, if you want to just give us a call, any of our nurses can talk to you and talk through, either a family member or you, about MCM. Not everything that a provider is going to recommend will be covered by medical insurance. We have an established process and guidelines that we follow. But like I said, just give us a call and we can help you through that. And that's how you enroll also. It's not, once you enroll, and it's not like required that you stay enrolled. If you enroll, we give you a little bit of help, and then you feel like you're done and you've got this and you can make it on your own, you just give us a call and you can disenroll. It's part of your regular benefit. So there's no additional cost. And then how long MCM? We're going to get you through your to your goals. Provide the advocacy, the support, get the durable medical equipment in there, make sure that you're confident in your treatment plan, make sure you're confident with your diagnosis, that you are able to make the decisions that you want to make and have the support that you need. And then we'll close to MCM. We don't open indefinitely. We're looking to achieve our goals, your goals. And if there's ever a time where something occurs where you need to enroll again, you can give us a call and we can re-enroll. It's not like a one and done type thing. And you can go to the next slide. I think that brings me to success stories. So I just wanted to talk a little bit about, we have many success stories, but I have one in particular that I was going to mention. I have a little guy who has cerebral palsy. He is still ambulatory, but he has a lot of stumbles and falls due to weakness from the cerebral palsy. Very active, enjoys playing with his peers, and we were able to come in and put in a safety gate at the steps and make sure that he, if he stumbles or falls by the steps, he's not going to fall down. Also placed grab bars at his, or like in the bathroom, for safety in there. And they asked about a tricycle, and although we weren't able to help with a recreational tricycle, we were able to help find the financial resources for him so that he was able to obtain that tricycle. And last I knew, he's riding around with his buddies around the neighborhood, just very happy to be able to have that. And I think Karie had another one to share with us too.
I do. I love that story. So my success story is from a mom, and she called. She had heard about the medical case management from a friend, and she had called and she was very frantic. Her son, who is 21, college student, senior, was recently diagnosed with cancer. And although I needed verbal consent from her son, I was able to talk to her about medical case management in a general term, sense, and how we could help her. I got verbal consent from her son in order to be able to speak to her and to the son, they're both the members. And they had believed got 95% of the cancer removed, but he had not yet had a follow-up with oncology. He had not had any scans, and they were having a really difficult time getting a hold of oncology to make that appointment. And in the meantime, it was his first week on campus, and she's busy with her job. She's an hour away from him. So the level of stress, given the new diagnosis, was huge. So we wrapped our arms around them with our external case manager, and she actually was able to meet the member at his college house. and they were actually able to come up with his class schedule, when she could contact him, the best way to contact him. And within that week, we were able to get in with oncology. The next week, he had a PET scan, and it was found that they did not get 95% of the cancer, that the cancer had actually spread to his brain and to his lungs and into his bone, which was devastating. That was a devastating diagnosis, and the family was overwhelmed. But we were able to get him a chemo appointment within that week, and the member reported that he was already starting to feel better. So although it was a very challenging diagnosis, it's positive because he was able to get the help that he needed, and we were able to really move things forward for the family in order to get him the best care that he wanted for himself. So it was amazing. I mean, this family, it's life-changing for him and his family, and it just was work on our end, and we were so happy to be able to do that. So that's why we're here at MCM, and that's why we're here as nurses, to really wrap around our members to get them through those trying times. So if you ever have a question about if MCM is for you, you just give us a call and we are happy to talk you through it.
Thank you so much, MCM nurses. Thank you so much. This is one of our premier resources, and I'm so glad you had an opportunity to come to the conference and share information from you. I talk about it often when I'm at schools. I always bring it up and ask people, have you heard about medical case management? You need to know. Now, let's see, it's 100 people in here. Now, you know, we don't, you won't see a billboard on our resources or commercial, but we tell you, and this is an opportunity also for you to see how you can tell your colleagues about it, because you see what's happening at your school. You'll hear about different situations, and if they don't know about this help, they could go through a very serious situation without the support that can be provided. They have the benefits for it. So we depend on you, our Worksite Wellness members, and to incorporate this into campaigns, lunch and learns. Also, often the school business office will notify the field rep, and they'll let the family know. So I'm so happy about this, and you answered all of our questions. I'll give people an opportunity, if they have a question while you're here, you can answer it. I don't see anything in the chat, so we are going to move on. I thank you so much.